9:03, I guess. The first item on the agenda is the approval of the March 17 meeting minutes. I hope you have reviewed them. Any comments on them?
So if there was ever minutes that you were gonna read, this would be the one to read. Right. Because it was the summary of our CART meeting, which we were all here, and I did want to mention that Ileana Caron, would you, who's our representative from DEP is here.
DPH.
Oh, sorry, DPH is here. And so I wasn't sure if we wanted to just quickly introduce ourselves or just.
Oh,
Okay.
let's just finish the beginning of the discussion on these minutes. Are there any comments? If not, a motion to accept.
So moved. Second is.
Moved and seconded to accept. Any further discussion? All those in favor? Aye.
Aye.
Thank you. Motion passed. All right. Thank you, Jane. We should go ahead and introduce ourselves. I apologize for jumping in. You know me, I'm always trying to get the business done. Pat Levine, Sheffield Chair of this organization.
Jim Willis, Tri-Town Health, lead rep.
Jill Sweet, lead public health nurse for the Southern Berkshire Public Health Collaborative.
Ellie Lovejoy, Mount Washington representative.
Diane Romeo Lennox, representative.
Jane Smith, Town of Alford and Shared Services Coordinator.
And on our remote screens,
Brandy
Hank
Page,
Warner. Oh, go ahead.
Brandy Page, Town Administrator in Otis, sorry.
Hank
Great.
Schwerner, Stockbridge.
terrific.
I am Ileana Carrion. I'm the program coordinator for the PHE grant. I cover the Western Mass individuals. Nice to meet you all. Nice to see you, Jane and Jim.
Nice to see you.
Thank you for being here.
We usually have more people, but it's like 85 out, so.
And one other on remote?
Irene
Goodwin.
I'm a Tri-Town Health co-responder.
Great,
That's right.
terrific. Thank you. Okay, the second item is the public health nursing program and an update on that from Jill.
So I did the quarterly report. I've also included year-to-date for the diseases. So that's the fourth column or sixth column I've added, everybody can see that. Blood pressure clinics, they're doing okay. New Marlboro's was new. When did they start? They started February. So hopefully that's gonna pick up some steam. And then we had the Get Boosted campaign with the $75 gift cards. We had 124 people get boosted. I was really hoping we'd have more kids, the 5 to 11 group, but we didn't, not even 12 to 18. The 19 to 64-year-olds, they really took advantage of that. We have people, I listed all the towns. We had people from Connecticut, Springfield, West Springfield. So I was happy. Car seat program, a new grant just came out for the state, so I'm just gonna apply for that one. I'm not gonna do the Buckle Up for Life grant again. So I've ordered 5 infant carriers, which for 4 to 35 pounds. Actually, I have a couple that are already reserved now that I know that I'm getting the grant again. I've ordered 42 convertibles, which is what I had this last time. Those were great car seats. Just 5 combination seats and 4 no back boosters. And then 84 car seats have been distributed up until the end of the last quarter.
And how was that installed during the program in?
So we had the car seat event with Sheffield PD, and that was great. I think we checked 15 car seats. I gave up 7. So I was really happy with that.
Great.
Yeah, and then I had somebody from the car seat day contact me again. So that was good. And then hopefully I'm gonna get an email to Cam Sibley. He's a Lennox firefighter lead PD person, because he was in my class. He wasn't able to join us that day, and the Lennox Community Center director actually had reached out to me about having an event, so I'm hopefully we can have something in Lenox.
Yeah, she's excited if you do it.
Yeah, she's really excited, so I'm hoping we can pull that off at some point. And then the Kiwanis of, are they Great Barrington, Sheffield? I'm not sure where they're from. Sheffield, thank you. They want to do a bike rodeo. They haven't done one in about 10 years.
What is that?
Oh, wow.
So,
They lasso bikes.
yeah, exactly. They last out bike. Trying to think, when my kids were little, we went to one.
Yeah.
Kids like bring their bikes, like bike
They-
safety.
Then they have gymkhanas with bikes.
Yeah,
They do races and.
and then try to get some free helmets.
Oh, nice.
Yeah, so I asked Pat if, so Pat Selby is the one I've been in contact with and, asked like, who purchases the bike helmets? So we need to look for some grant money for that. So she's thinking summer, which I think would be great. We can partner with them to do that. She had the last one was down in Sheffield at Under Mountain. She says it really wasn't well attended, so I'm hoping Monument or Muddy Brook.
Mhm.
That might be a good place.
Muddy Brook is probably the right age.
Yes,
range.
exactly.
Yeah.
Those are the kids that we would be targeting.
Right.
So yeah.
And you have something tomorrow, right? The baby palooza or
Yeah, so I'm
something?
going to Baby Palooza up at Great Lot Works in North Adams. It's a community baby shower for those that are thinking about being pregnant, are pregnant, had kids. Everybody name is gonna be there, WIC, DCF. I don't even know who's gonna be there. So I'm gonna go have a couple car seats with my little demo babies. Hopefully get people signed up to have the car seats checked, let them know that, you know, I do have 3 car seats. Pittsfield WIC has been referring a lot of people to me, which is great. So I'm hoping once those nurses get certified and they can write a grant that we can spread the love.
Terrific.
Yeah, so I'm very excited about that.
Anything further?
I don't think so.
I have a quick question about the Giardia notes that we've got in here.
Yeah,
Do we have any, is there any follow-up on those? As from DPH, as to source or whatever, do they report that? And how do they go about?
so which one are you talking about?
Well, we've had a couple, there were some in Sheffield and there one in Sheffield and one in Lee.
The one in Lee, the lady had pet chinchillas, so I'm thinking that was the source because she's on town water. Basically goes to work and comes home and that's it. So I had to Google to see if chinchillas were carrier and they are.
They are.
Yeah.
Every mammal.
Yep, and then the one in Sheffield, oh gosh, when was that one?
Yeah, I'm just curious.
Oh, that was way back, that wasn't in this quarter, I'm thinking that was a water,
A well.
maybe a
issue.
water source, like, I don't think. Was he out on a hike and decided he was gonna
Yeah,
drink
take a
water
drink
from
out
a
of
stream?
It's a
maybe?
pristine stream.
Yes,
There
a
you go.
pristine stream, I think
Yeah,
that's what it
those are
was,
always good
yeah,
ones.
and I'm like,
I mean-
don't do that.
I mean,
please.
like, I have some thoughts and ideas on how to assist on answering that question further. So like, we talk, say it's like food, waterborne, foodborne, like
Right.
Jill has come to me several times, doesn't tell me exactly the issues, it's not my business and all. the
Right,
towns. You're
right.
like, oh, think about water supply, think about wells, are they hiking,
Yeah.
not untreated water. And on the foodborne side, like, we have an internal protocol anyway that we always notify the health agent.
Mhm.
So like we are required to go out while Jill's doing her clinical thing, we'll assign an inspector to go out and do a food inspection. Based on the complaint, do it appropriately, and then we scan it into the system and give it to Jill and she uploads it to
To
that.
their case.
So we're actually, we're taking it a step further
Right.
as compared to like the old days of just doing it. and
Right,
replying.
yeah, I was just curious, 'cause we're dealing with a lot of this right now, and it's interesting because, and I'm curious as to whether or not DPH has a stream to follow up, so to speak, to follow up on these types of things, because they are doing the private well regulations. This is going through the legislature now, and there's a whole lot of stuff going on, but these are things that are important for people. to
So I will tell
understand.
you, when I finish my case and do in the question package, administrative question package 1 through 5,
Right.
there's always an epi that's looking at those, whether it's, no matter what it is,
Right.
so they know, like, I'll make a note, like, they were swimming at Beartown on these days. And so they're also monitoring, they know when, like, the beachfronts close at, like, Beartown.
Right.
So I
So we should
identify
be-
something and put it in my notes, DPH will see that,
Okay.
yeah.
So
Well, yeah,
we should
keep
be
it
able to go to the
Yes.
EPs and find out what they're collecting statewide for these things. I'm thinking not just the local thing, but really looking at trends of places that,
I'm sure you can find that right on the state website.
yeah, they didn't really have a whole lot, but, okay,
Yeah.
I'll go for it. Thank you. That's
Yeah.
very helpful.
I mean, I had a couple questions, not, I don't know if it's questions on the report. So thanks Joe and Jane for adding the cumulative to date.
Yeah.
One of the things we're thinking about is, when you get to the fourth quarter, we close out the fourth quarter, rather than write a whole nother annual report for the towns for like the report, you can see the cumulative
Yeah.
numbers to date. And so you can actually take the fourth quarter report, at least with the metrics, and you'll know how your fiscal year landed. I was really fascinated, Jill, to see your breakdown in numbers with the vaccines. Yeah, a bunch of people from, the highest number was people from Pittsfield coming down. Is the Alliance doing, was
They
the
weren't.
Alliance doing the booster program?
No, they weren't,
Interesting.
yeah, they weren't.
I believe that we were the only one in Berkshire County.
Yeah.
that
Oh,
was-
really?
Yes,
Oh, wow.
yes.
And then, yeah, I'm still fascinated how the 1964 was a lot higher than the 65 plus. I would have thought the 65 plus would be in really high demand.
Right, but they may have already.
Yeah, a lot
realized
of people,
it
yeah.
and got-
When it became available, I think a lot of people,
Ran to it.
right,
Yeah.
yes, they were like
They were right there.
sprinting, yeah,
Yeah,
Yeah. Nice.
yeah.
Some families came in and they left with like.
5
$300,
gift cards.
You know?
The kids were thrilled, like some kids, they're getting a gift card, they're like, what? I get a gift card? Like, yeah, where do you wanna go shopping? One kid's like, I want Humvees because I'm going by candy. I'm like, good for you.
well, Sheffield is certainly represented in the vaccination.
You know what? That's because the Sheffield Times put an article out and that's why.
Great,
Yeah, so I was happy to see that.
good.
Yeah.
I mean, they're always happy to put things in there.
Right,
If you
yeah.
know Andrea.
Yep.
Scott, yeah,
Yep.
good.
Well, it's fascinating. It is fascinating and concerning that we have these many communicable diseases in our town. So
yeah.
it just goes to reassure like the importance of a comprehensive public health nurse program, because when people don't see these numbers, they don't know that they exist. And they're pretty high in some of these towns.
Some of them, yeah.
The
Right,
Great
and-
Barrington leads the charge.
And it also shows that, SARS and COVID too is,
Still
has had an impact.
Mhm.
This is all waiting bated breath for everybody to cancel everything. But it's important for people to remember that people have been pretty sick over the last year, and a lot of them.
These come to you, these infectious diseases by way of a physician's office?
Maven.
Maven.
Everything's through Maven, yeah.
And that's how they get in though, is from a physician's office?
Well, a doctor's office, hospital, lab.
Right,
Yeah, so anything positive communicable disease is automatically reported to the state.
Right.
Yeah.
So these are not things that you have necessarily experienced.
Nope.
But they're coming through.
Right,
that
yeah,
system.
everything
Great.
comes through Maven.
Thank you.
Back in the old days, Pat, you'd say the ER infectious disease lab identifies a reportable, they used to fax it to the health departments back in the old days.
Mhm.
So now everything kind of just gets shuffled into the
Right.
system,
Right.
and then it gets broken down and sent to the appropriate towns.
Right.
Yeah,
Theoretically, but one of the
Theoretically.
problems is that it goes by zip code.
yeah,
So when you share a zip code, or they report to they're not permanent residents here.
Right.
So they live here like 9 months out of the year, but it goes to New York State and it never gets reported
sometimes,
back.
yeah.
Yeah.
So, well, for those fringe towns that are the heavy second homeowners, that's had an impact,
right.
yeah,
Right.
which is why the fax thing wasn't such a bad idea.
Okay, thank you, Jill, very much. Old business, DPH capacity assessment summary, which we have a document, yes, no?
Well, so this is, Jim this is this,
Oh, that's the work plan.
that's,
Yeah.
oh, that is. So
Right.
yeah, so that's basically just the minute.
Okay, right,
Yeah, well, and everyone has a copy of the CART capacity assessment. You
right.
know, and I think, do we want to mention, do we want to talk about, we did meet as an executive group to kind of go over those priorities. Do you wanna talk about that now or?
Or when we talk about the work plan?
Okay.
Okay, great. So that would be the priorities and goals. Right, that will be part of the work plan.
Yeah, there's a couple different things going on. The priorities and goals is that working document that we had been working on for a couple of months.
Oh,
Just to bring it back to your town and say, oh, what do you think? Then there's the actual work plan, which we started to carve out, but that was supposed to be part of us knowing how much money we were gonna get post capacity assessment. So Jane did an excellent job of attempting to think about a work plan, assuming,
Right,
you know, our priorities based on the executive committee meeting. So it's not finalized. The work plan's due the 28th, and I don't know if that's been extended, but I know we can't really put a budget together and a work plan with the unknowns of the dollars.
right, right.
Yeah, we're planning to modify the deadlines because of the delay with letting you know how much money you're gonna get next fiscal year. So hopefully we can get you that information soon. I'm sorry about the delay. I was hoping to get that sooner, but they haven't
the
given
thing-
us notice yet.
And what, I've been going on and scouring actually a lot of websites for towns for the fiscal year 23 budget. And they're asking for what was appropriated in the fiscal year 23 budget. It's funny because when the first time it came around, they were not asking for fiscal year 23, they were actually asking for fiscal year 22 at that point. So a lot of the updates are just updating from one year to the next. But there's been a couple of questions. One is, I think a very significant question, which is like some towns have their transfer station as part of the Board of Health budget. And I know that the Alliance is dealing with this too. And so, you know, there might be a town that has a $950 Board of Health budget. And then, you know, a $20,000 or more transfer station
Right.
budget. And so, you know, I think one of the things that we're mostly concerned about really is that per capita, like, we know that it costs more per capita to serve people when you're in a small area. We know that we have septic systems and wells that the larger cities don't have. We know that some towns double, triple, quadruple in the summertime. And so the infrastructure and housing is not represented in the numbers from the census, right? So we're already stacked up against that. And then to have a number that is so misrepresentative of like what we're actually having for public health, it's just making us nervous because we don't want it to impact negatively the amount of money that we really need to fund our public health services. And one of the things that we're hoping, and talk to Sandra Martin about this as well, is having the ability to quantify. So like, you know, X town, you know, it says that this is how much has been allocated, but a note saying, you know, but X, you know, 95% of that is for the transfer station, which has nothing to do with
Right.
the capacity and the priorities that are put forth in the assessment.
Do we know how many towns that's the case?
I believe it's just one so far, just one town
Okay.
has that,
So
so.
that's not too bad. I mean, then we have to keep track of that and be sure the note is
It just would be
appropriate.
nice to be able to note it.
Right,
And then the other thing is, the DPH did a good job of like allowing us to, say, for full-time equivalents, the lowest amount was 0.25 full-time equivalents, which is 10 hours a week, by the way. My best story has to do with Tyringham, and I called the inspector and I said, Al, about how many hours in a month? Because I learned not to ask a week.
right.
Because
It varies so much.
yeah, I said, about how much a month do you work for the town, do stuff with town of Sandsville? He says, well, I'm up to 10 so far. And I said, for the month? He said, no, the quarter.
Oh,
Oh, he said, put me in for 50 hours a year. which is a lot less. I was like 0.00, whatever FTEs, and so that's, I think, good for the state to know as well. So,
Right.
yeah, so those,
Well, and I guess it calls to mind how the question is how unique is Berkshire County? Or are there northern parts in the central county that are similar to us, or southern parts, certainly not Springfield and Worcester and so forth, but the more rural areas outside of those areas? I don't know.
Franklin, Berkshire, and then the Cape are all similar.
Mhm, mhm.
Yeah, and I think I'll just add, since we have Ileana on here, you saw all my emails of my concerns that I sent to you, and I forget whoever the other DPH person is, because, you know, like, look, we're gonna give the DPH whatever municipal budgets that we have, but, you know, for someone that's been doing this a long time, I get concerns about equity within our own collaborative. Meaning, you know, Tri-Town has, the Tri-Town operating budget is very large. The Great Barrington's budget is pretty large. If you look at, and I don't know what town has the transfer station, but if you have a 15, I'm just using this as an example. Otis has a $20,000 Board of Health line item for the health or whatever. And you add another 300,000 to the transfer station. On paper, in the general ledger, maybe under the Board of Health account number, but it's not really functions of the Board of Health. I just get nervous, Ileana, that you'll see the per capita blow up to a point where, I mean, the capacity report already shows our collaborative being above the state average per capita. We've already discussed that, and I know we put those notes forward because it's very misleading. But like, I just don't want to see like the Sheffields and the Sandusfields and the Tyringhams of the world that don't have a lot of resources, nor someone's jumping in, Jane, on the call. You know, these smaller towns that don't really have anything being forgotten about or kind of tucked under the radar, because now the per capita, and now that we're reporting on massive budgets that don't really fund core public health services for that town. It's just the way the town sets up the accounts.
Well,
I
and
just want to be mindful of that.
Yeah, and I've just discovered, I pulled out my own budget for Sheffield, and I realized, and I knew this before, but had forgotten it, that my budget has the whole clerk line, whereas we only benefit from 1/4 of it. But the whole clerk line is in here as though it's for the Board of Health.
Which it isn't, right?
So
Yeah,
that's another problem that we have to be
Which,
aware of.
which shows the design of the study. I mean, it's great that this is all going forward, and what I'm hoping is that DPH is gonna, you know, act on it and account for it. You know, I mean, we do the same thing with retrack. You know, on how many of those questions honestly don't fit, you know, so that's one of the things. I mean, this is the first survey that we've had for, you know, for forever, actually, right?
Yeah.
So there's gonna be stuff that they're gonna
Yeah,
have
we're
to
learning,
adjust.
we're all learning, yeah,
so.
And
great.
so back to this work plan, it's a state, and it's a little bit small, but it just, there was so many.
A little bit.
I couldn't fit on there.
Okay. But let me tell you the long and the short of it, right? This is the long and the short of it. I believe that if we can get a full-time inspector, if we can get a community health worker, okay, to help with admin, help with Jill's initiatives. I mean, I don't know if you guys get the feeling, Jill's doing amazing work. She's so good with the public, like, people are so appreciative, and for her to have the support, especially when she's going on car seat fittings at people's homes or doing homebound, like, we want to make sure that we're protecting Jill and also allowing her to do like her magic. So that's one. And then, you know, obviously my position full-time. So what is in front of you in small print, and this was emailed out.
Yes.
But, you know, that things like, you know, so there's 5 objectives. So one is to have it hire and train shared inspector staff, so like a full-time, and then having per diems as needed. That makes sense, especially geographically.
Which inspector
Well, we're
Anyway.
assuming we're getting money for an inspector.
I know, but there's housing inspection.
Oh, no,
there's
no,
food inspection.
we hire a full-time health agent across the board training.
I see.
We don't,
Okay, okay.
I don't,
Right.
Yeah.
it's my philosophical approach as a
Yeah.
manager for
We
many
have to
years,
be
that
able
we
to
don't
do
hire
it.
siloed.
That's
people.
fine,
Yeah.
that's fine.
Yeah.
I just,
Like
thank
she
you.
said, if someone comes to us with a lot of food experience, for instance, we're gonna have to decide as a group, like how to best use them while they get built up in the other
Yeah,
areas.
yeah.
So we have capacity we have the collective knowledge in our group. And so, so we would kind of just see kind of how that makes the most sense and to get that person up to speed.
Well, that also is important on where the alliance stands, because they're getting a lot of money to be the training hub, and as we hire people, they're gonna need access to that training, whoever
Right,
the
right.
trainer is.
Yeah, but if we could, can we refer to it more as a health agent than an inspector?
Well, they're intertwined definitions, to be honest
So
with
it's
you.
my education.
Well,
Okay.
that's interesting because, the health agent actually is a different, an inspector doesn't actually act for the Board of Health. An agent acts for the Board of Health when the board cannot conveniently meet. That is the definition.
Yeah, it's
So-
it's semantics, to be honest with you, like let's not get
Yeah.
caught in the mud on that right now.
And so hire some people.
Right.
Yeah,
Yeah.
a full-time person.
Yeah.
And then, so some of the things, in addition to that, is like conduct a community needs assessment, right? Let's go to the towns and ask them what it is that they want. And we're gonna be doing a pretty big push on this to ask each town to collectively tell us what things are important to them, right? Because there's 12 of us and the needs in one community aren't gonna match the needs of the other community. So
Yeah.
that process you'll be seeing, once especially if we're able to get our public, a community health worker, that will free up capacity also, to interact with the towns, right? Work with the towns to identify opportunities for shared inspectors or administrative support through intermunicipal agreements. Right, that's something else that will build the capacity, hire and train one-time, full-time inspector and part-time inspectors to serve inspectional and administrative needs of the shared services agreement. And then roll out inspectional services to meet the inspectional and administrative needs of towns in the public health excellence group. So that's kind of how that goes, right? It's all under the one setting. So objective one, that objective two is expand staffing to support the public health nursing program with primary focus on work in special community projects with an equity lens. So that's where this position becoming full-time, that helps build that capacity.
Jay, not to interrupt, but Scott's jumping into, sorry, I know you're doing multiple things over there.
And then that's where the community health worker comes in. Anyway, so that's kind of how that goes. So then the third objective is improve backup documentation for food protection, housing, recreational camps, and other inspectional services. So, evaluate where each town is at, provide forms and trainings to help improve that. And then for towns that have the permit eyes 2020 system, that would be an opportunity to help fund, for towns that don't have online permitting to implement that. So you can see how that's kind of an objective.
Jay, quick question, what towns don't have any online permitting at all? Probably Mount Washington.
Washington, Sheffield, Sandusfield, Tyringham,
Yeah. It's about half.
New Marlboro has it, they're just starting to use it more, but it's the old system, so they might want to upgrade to the 2020. That's a question for them.
Cool.
So then one of the things that the state had talked about is they really wanted tobacco control, all of the towns that were eligible, not realizing that there's, I think, several towns that don't even have a tobacco, so obviously we're not gonna go for that. But that's Sandusfield, Sheffield, and
Those two, this Marlboro.
New Marlboro. So working with the state, saying, hey, we'd like to add them, how can we do this? We're gonna need support from DPH to have them open that up. and Jim can talk more about that. You know, identify, if that doesn't work, we can identify some other funding sources to try to get those services in the town. And then we can always provide education. So that's under that objective of tobacco. And last but not least, is just really continuing to support our public health nursing program.
You
So,
just hand it all over to Jill and Jim.
yeah, just, no, taking the needs assessment and developing more programming based on that. You know, one of the things that is missing from this area right now is a fall prevention program, and Jill's done a great job of looking at that and, you know, looking to see, like, there's no one that's doing fall assessments at home, for instance, right now. That's a definite need that we know,
That's from the house.
you know, matter of balance classes, you know, in the senior centers. Do we do it? Do we hire someone to do it? Like, just trying to figure out, and then the last thing which is, we're making a little headway on, is providing language appropriate programming to the area's Spanish speaking population. So that support from flyers to sign up to when they get there, that we have something in place that's going to make sure that we can serve that population without it being real stressful for anybody. So anyway, that's this in a nutshell. I know that was really fast, but so that's our ideas based off of the conversations that we've had so far. And what we really would like to do is get from you guys, like, what you think about that. Or, you know, is there another direction that we should be going in?
Or should we wait until we see what the finances are? And see whether what you've outlined, whether we just have to prioritize more because we don't have enough, or we've got more than we think we would, or thought we would.
Yeah, we can try to schedule, I mean, it all comes down to the money, right? Like,
Right,
the work plan that Jane put together will be modified according to the funding. You know, like, I mean, for someone that does budgets every day, I know where I need to be financially for full-time CHW and a full-time health agent with resources for possible upgrades to permanize. I mean, we may have to do permanize, rotate,
right.
grab the first two towns first year, then add the second one the second year, maybe kind of pricey, but like, I think the work plan will have to be pared back or paired up
Yeah,
based on the resources. But I
Right.
think, which,
I think I would ask though, just at the 30,000 foot level, is there anything that Jane articulated that you think she's really off, we are really off base on, and that we
And
don't,
actually, no,
right?
no, I think I think it was incredibly accurate. I mean, I'm also in favor of asking for way more than you think you're gonna need. And say, look, this is a priority, and you know what, you don't wanna give us the money, fine, but it still doesn't make it a priority. If we have populations that need that support, I think that's a very important part for this group to do, is to advocate for the fact that for a really long time, we have a lot of target populations for various problems that have gotten lost.
Well, I
And-
think
and so-
maybe what is somewhat missing in here, and it's probably in here, but I'm not sure, is collaboration with other agencies. And I'm thinking of that specifically because VIM is just in the process of sending Spanish language speakers to all the food pantries at least once a month. So collaborating, that's the horse I ride a lot with VIM, but with other agencies to be sure that that we're getting the best use of our people and that they're able to use us when it's appropriate. And I think you're doing that when you can, but I think making that a overt effort of what we do.
Well, some more of that ends up being in the coordinator position.
Yeah.
And keeping track of people who are, love adding things to you, and. But it seems like you would be able to sort of touch base with the different groups to say, well, look, are you working with so-and-so? Are you working with so-and-so? Are you, and that's.
And I've been going to the basic meetings, which are
Sure.
for support.
Well, you can't go to all of them.
Well, and that's been good, and I'm still like in the mode where I'm just kind of in the background, because it's important that there's trust and relationships in the circle, like, this is supporting immigrant population group. Sometimes we talk about uncomfortable things, right? And,
That's right.
and it's important to be at the table and hold that space, but as far as collaborating, I mean, for me not to be having to do some of the things that I'm having to do right now to cobble up my position, it's gonna be, I will have capacity.
Would make a big difference.
Mm.
It would make a big difference.
And like things like we rolled out the Sharps program, for instance, okay? But, you know, we had a guy come in thinking, to my office yesterday, thinking that he was in the DPW office. And I identified, for some reason, I just felt he might be a diabetic, so. I mentioned.
You pegged him right.
I pegged him right. And, so I was like, oh, you know, feel free to grab a Sharps container. He's like, oh, I already have a system for my Sharps. And I said, oh, what is it? And he's like, well, I take a milk jug.
Mm.
And I put all of my needles in there and then I put it in the recycling. And I said, so I was just like, okay, well, so just so you know, my husband used to work at a facility that did, recycling. And I'll tell you what happens is it gets all ground up and then you have all these needles.
Mm.
And it ends up pricking people and it causes a real problem on the other side. And he's like, I had no idea. And I'm like, I'm sure you didn't. So I gave him a container and I said, you can bring it anytime and put them right in here. And then you won't have to worry about one more thing. And we had a good laugh and he was on his way. So here's somebody who thought that they were doing the right thing. And so my goal is to be able to have the capacity to do things all the way. We're making baby steps, but wouldn't it be nice to have a campaign that's like, do you know?
Oh, yes.
And have 4 or 5 things that are running on the radio, going into Sheffield Times, like. We actually have the foundation work, we know where we need to send things, but the making sure it's correct. Getting it edited and sending it out is just a lot, it is a lot of work, and that's where.
Well, that's
having-
also administrative.
Yeah.
That's where you get administrative help of people who, are good at putting these things together or good at proofreading
Yeah.
or can sit there and make those 15 phone calls for you that will take you all day for people to get back to you, but you have somebody who is,
Right.
doing it from home or whatever. And I think that's really important. And I also think one of the collaborative things too is talking to doctors' offices and asking them why, for their $500 an hour, they are not following up with their patients for training them as to what the options are, so that they're not, doing stuff, because that's something, and that's a collaboration with Berkshire Health Systems that is very badly needed on a lot of levels. It's not just the Sharps, which of course is something that we're focused with. But bringing these organizations in, I mean, VIM does an incredible job with outreach. BHS, not so much,
Mm.
but look at their budget. Holy cow.
So a couple comments from my end, I can wrap up regarding collaboration. So the original work plan that we're actually working off of, not this document,
Right.
is loaded with collaboration, BCC, VIM, whatever, So we can pull some of that to fine tune that. This was really a stab at a work plan based on the new funding.
Right.
So we still gotta marry
Right.
whatever's on the existing and with the new, so it will be a lot of collaboration in
Yeah,
there.
good.
And if you actually look at the nurse report,
Mhm.
you look at the last page, you'll see just the
Yeah,
collaboration
yeah,
that we're working on, so.
Absolutely, yeah.
I want to say that Ileana is having the money come first and then the work plan. Like, if it's gonna continue to be delayed, maybe DPH wants to think about, like, for us to say, for X amount of dollars, here's what we feel like we can do with it. And have you guys consider that versus just coming out with
Us
like some
telling you
random
rather
number. Cause here's what I'm afraid of. I'm afraid we're gonna get $50,000, right? And we have no idea what the scope is and.
It goes our
this-
inspector.
Like this alone is probably gonna be $200,000 minimum and we could do more with more resources. So what do you have? I see your hands up. I don't know if you have any thoughts on that?
Yeah, I just want to make a few comments. First, I just want to say thank you for allowing me to come into your space in this meeting because I've enjoyed it very much. And thank you for everything you do. I know it's really frustrating to try to build a work plan when you don't have valuable information, which is knowing how much money you're going to get. And you really need to base your work plan off of that. I understand that. What I can say, and what, as far as I know, is that you will be level funded. And we're trying to get that funding eligibility information as soon as possible to you. We were hoping to have it earlier, and I was eager to give you that information because I know that's what you need to complete your work plan. But unfortunately, if I'm not given that information, I can't give it to you because I don't know. But I hear your concerns. I hear your concerns about this, and also your concerns about the capacity assessment, and all of that information that you give me. I forward it to the people. I read it, and I can't give an opinion on it, but I read it and I give it to people who I know they can, use it and maybe make changes or talk to other people, especially BME, the people who made the capacity assessment. And I can definitely speak to my supervisor, my heads, about the concerns that you haven't received your funding eligibility yet, and you're being told to make a work plan without that information. So I hear you on those fronts. And I think you're doing, I personally think you're doing really great work. When I hear these conversations and what you're talking about, it brings joy because I think it's great, especially, that example you used, Jane, when someone walked into your office and didn't know what to do with needles. My aunt is a diabetic and she also didn't know what to do with needles. So I know exactly what you're talking about. And Jill, amazing work you're doing as well. I think that us coordinators, we want your success, especially when it comes with PHE. We want that. That's my job, your success. So being included in these meetings is valuable, not just our quarterly check-in. So you report back to me and I tell, my supervisor what you guys are doing. I like being in these meetings and knowing in a more higher level what you're doing and what your plan is. So all I can say is that I apologize that we don't have that information. I know it's frustrating. Before I came to this job, I worked for City of Holyoke in local government, and I worked as a mass and motion coordinator. And it was so important for them to tell us, listen, how much money are we going to get to see if we can continue of hiring this person? So I know where you're coming from. I hear you, and I wish I had that information, but I can say that they're working on it. And as soon as they have it, if it comes at night, I'm going to be emailing you as night. As soon as they have it, I will do my best to get you that information as soon as possible. And also, unfortunately, I need to head to another meeting, but I do want to end saying that I appreciate being invited to this meeting because I know this is your space. And I'm, I know I'm a person from DPH, but I'm still a human being, and I hear everything you're saying. I'm still a person.
We knew that from the beginning.
Still person, still functioning.
Yeah, please understand you're always welcome. That's
Thank you
never a
so
question.
I
Absolutely.
appreciate it. I really do, because I enjoy knowing people more on a deeper level. And I'm in Amherst. I'm a Western Mass native. I've lived here my whole life. I'm not near Boston. I've lived in Western Mass, so I'm happy. And I've been to Berkshire numerous times with my family. If I ever am invited to come in person, I'll do the drive. I'll come in person and I'll meet you all in person. Happy to do that. So yeah, just let me know. But thank you
When
again.
you bring the check, you can come in.
Yeah, you can deliver the check.
Okay. I'll tell my supervisor, I'll bring your funds in person.
Yeah, there you go. I do have one follow-up question. So as I confirm the budget amounts, I am pressing confirm and putting, or, confirming or changing. Is the quicker we get that in, the quicker that you guys have the information that you need? Is that like, I'm just trying to give you accurate information.
Yeah,
Okay.
I think what's best is definitely, I think you're doing the right thing, drafting a work plan based off of what, as far as I think you can keep doing that, but what we are going to do is, what I do know is we are adjusting the deadlines, because since we haven't gotten you that information, I don't think we expect you to have that ready by when we're saying if we can't give you the information you need to complete it, because we're, going through our processes internally. So I think having
the Google Doc that has like full-time equivalent and the budget information. Can you see that? Are you guys looking at that before we submit it? Since I'm waiting for a couple straggler towns information.
Yeah, I don't think we are right now. I have not What I'm
Okay.
planning to do is after this meeting, I'm actually gonna be sending you an email with your Q3 narrative template. Cause the Q3, the quarterly 3 stuff, that's gonna be due at May 1st. That's due, because you have the information to complete that. But the fiscal year 24 stuff is the stuff that we're gonna have to adjust the deadlines because we haven't given you the information to do it. So. But again, I hope to get you that very soon. We're aware grantees, you're not the only grantees who are wanting that information. That's really important and valuable information. So we want to get it to you. And I personally, once I get that information, I will send it to you as soon as possible. There won't be any delay there. Once we get it, we're going to be sending it out quickly.
Thank you.
Thank you.
Thank you.
You got another question, Jane?
Tom is looking to.
Okay,
I think that's just Jane's mouse.
Oh, okay. It was
All
a
right.
white glove, not a yellow
Yeah.
glove, sorry.
Okay.
back to the agenda. I think we've, under old business, discussed,
New business.
the priorities and goals.
Yeah.
We haven't discussed the opioid settlement fund. There was a long article in today's, Eagle, about how much all the South County towns will be getting, and a nice quote from you and you.
For me? What did I say?
Yeah,
No, it's when we
Was
were
it
at
in the
select
Eagle?
board.
Oh, the
Yeah.
last
This
one.
is again.
yeah, supporting the recovery center. So I'm hoping that I can convince Sheffield of its responsibilities in that area. Any other updates on it?
No, I'm still working on a couple towns. I'm still working with Lee and Stockbridge, but we'll do everything we can to advocate that it goes to the right places and.
Right,
And also, Ivy, who's our tri-town co-responder, is strengthening her relationship with the Rural Recovery Center too, because she does have a background in substance use support and whatnot, and we'll do everything we can on our end to make some of those things happen.
good.
I'm glad to report that Mount Washington has all of the papers filed, and as it turned out, in the original stuff, like 2 years ago, it said you could fax your information in, which of course Mount Washington did, because why would we use electronics? And of course, nothing happened, so I found all of the paperwork and said, and here is the fax information, and here is the little thermal paper thing that gives you the date and the time there. And so we now have our number, and it has to all be done electronically. And again, one of the problems is that they keep tying these things to cell phone numbers for texting. And people change their cell phone numbers, or they don't have cell service.
Yeah.
And this is a really arrogant assumption on the part of a lot of companies and government that this is the way it works. So I know we're not the only town, but we'll be getting our $15 now.
Good,
Oh my God.
good.
How much an hour?
Right, exactly. Right. Okay, under new business, we have gone through the work plan. I hope everyone has signed the letter of support for the, as SAPI, are they?
Safe, yeah.
Safe,
Yeah,
whatever.
our board hasn't met. But we could just do individually
Yeah,
too,
yeah.
right?
Yeah, that's
It
what
doesn't
I
have to
did.
go through my board.
That's
And
what
I
I
think
did.
they're gonna be submitting it Monday, the one that Western Mass Public Health Association is doing, the link is in the notification email. So, there is, it's going out Monday. I would encourage everybody to go ahead and.
I'll do it now. I'll do it
Yeah.
too.
Can we have it just say a car seat program, not a car seat fitting program?
Oh, did it not?
It's still on there. It says car seat fitting program.
Okay.
Yeah.
Jill,
No,
man,
Somehow the
I
editor
made
didn't
my
catch
wishes
that.
known already.
Well, I changed it in one paragraph. There must be another place. that
It's right at the beginning
It's a
under
bullet, right?
in addition.
Okay, yeah.
It's in the book.
Yeah,
Yeah. All right.
thank
Change it
you.
There as well.
Okay.
It's a very. polite
Subcommittee
letter.
reports, sustainability.
so we met once, Jordan, Jane, Ellie, myself and Rebecca, I think is on that. We met once and we kind of just had a conversation about, like revenue for vaccines, how much towns are putting in to purchase vaccines. We're gonna meet again to talk about the dollars, but we kind of just postponed that for another month, just it's like, I don't know why we're meeting, because we're like, we have a lot of information we don't have right now. But really, I think we're still trying to define what that subcommittee is, but like looking at, you know, what's our vaccine reimbursement look like? You know, how much do vaccines cost, and really start to think about down the road, how we can support our towns to be somewhat sustainable.
Right,
Because, you know, we're relying on a lot of PHE funding.
right.
Some towns don't have any budgeted dollars, you know, just to start to work on that and see if, you know, can we give recommendations on fees and things like that?
Good, good. Okay. Member updates. Anybody have anything they wish to share?
Our now Washington voted to expand from a 5-member board. They have appointed one person. And so we now have 4 members, which is great, but it's been 5 no matter what you do, which is great fun. Now Washington continues to be now Washington.
To be the leader.
I'm convinced that it's in the water or something. But
I want to just thank Dr. Hank Schwerner, who is on the Stockbridge Board of Health and is the liaison for our collaborative. He's not running for reelection, so this is his official last meeting, and I want to thank him personally because he's one of my board members for Tri-Town. And I want to thank him for his service for the Stockbridge Board of Health and to be part of this exciting endeavor for the collaborative. So thanks, Hank. I appreciate it.
So where does it leave us?
Oh, no, someone's on the ballot to run,
Oh,
but the election hasn't.
but I
happened
mean,
yet.
in terms of the medical advisor.
No,
That's
that's
Dr.
Dr. Kenny.
Oh,
Yeah.
okay.
so I have a question for Dr. Schwerner. Do you want to be on the Mount Washington Board of Health?
No, thank you.
Gosh, chicken.
Yes,
So thank
yes.
you, Hank.
Oh, thank you.
Thank you, thank you. Any other member updates? Okay. Citizens, do we have any citizens? I don't think so. We had them and they were already speaking, good. Trainings, Jane, do you want to review those? quickly?
Yeah, there's some good stuff going on, and so one is starting next week. We are having choke saver classes starting. So one in Great Barrington at this recovery center, one at Tri-Town the next day, and then trying to get a location in Sheffield. I contacted the senior center to see if they could accommodate us. And then I'll go back to the library once.
If it's on the 15th, then the library, the exhibit is cleared out, so the
Oh,
lower
okay.
level.
Well, maybe I'll contact them because I haven't heard back from the senior center yet.
Yeah.
And that'll include the Narcan?
That will include the Narcan training at the end. Mhm. And everyone will go home with a Narcan.
Kid.
So
That's not just open to citizens, right? Isn't that just for your food?
it's open to anybody.
It is
Yeah.
open to all,
Yeah.
okay.
I mean,
Look,
Chuck's
I'm gonna try to get our board.
maneuver, right? We're working with David Katzenstein. And I think he does a really good job if no one's,
Yep.
one of the things is just having access to the food, your food, program, your food establishments, and just making sure like that information's getting out. Eventually, it might be interesting to see if we can get a list. But you know, we wanna not overstep. Same thing, there's a Tuesday, April 25th, there's a, let's talk about food waste program. So the annual certification program, that's always a good thing to go to. It's the legal part of boards of health, which I think more and more we need to be aware of. And then the other things, so one of the things in our CART, our community assessment report, whatever,
Table.
is that we really should be looking at low hanging fruit is getting everyone, the ICS 100, the Incident Command System 100, and the SIM 700, so which is the National Managed Incident Management System. They don't take a lot of time, so I put the link in there. Happy to get the information out to people who are inclined to do it. It would be great for those people to do it.
And really pay attention because you gotta take a test at the end and it's not an easy test.
It's not an easy
The
test.
ICS 100 was a bear.
It was a pain in the neck, and I had to redo them even though I
Yeah.
already had them.
Yeah.
But that is something, it's self-paced. That's something to remind people of it. It's self-paced. You can do it, from your kitchen table, if that's what you want to do. This is something that I'm putting out to our board and saying, no, you all have to take this. Because you all have to understand how this works. We have an EMD that does not understand this. So the Board of Health is gonna have to stand up and understand that in a public health emergency issue. And how that works in with your EMD and all of that stuff, so it's really good stuff. And the certification program, if you don't have everybody on your board having done this, which we don't because they won't go. This is absolutely critical, and especially in light of the new ruling from the Supreme Court in Massachusetts. It is very disturbing that people do not understand that the alternative to controlling somebody who is really out of line at your meeting, there's two methods of control. One of them is that you can give them a certain amount of time, and if they violate it, you're still stuck with calling the police. The only way to make people understand that the way you don't have this problem is you do not allow citizen speak at meetings. That is so, in my personal opinion, so antithetical to the idea of Massachusetts.
Right.
But I think it's really important to make that point to people that we've gotten to the point legally where the board has to understand that they have to be in lockstep, that when something happens, you vote to go into recess and you leave the room and you stand in the bathroom or the closet or wherever you have to stand until those people leave. Because then your only other alternative is still to go back to the police. And that, it never works. It never works. So it's really, really important for your committees to go.
Jane, one thought I had on that, and I know we're wrapping up, is I wonder if Mass Municipal or MAHB are thinking about possibly a training for, elected board members on this
They
stuff.
absolutely will. I've already talked to her about it.
I'm familiar with this situation, gone through it personally and at meetings that has happened. And also too, the First Amendment, there's a group that actually, we did a whole training at Tri-Town about how to react to when people show up with cameras at your office, what you should and shouldn't be doing. The town at least sponsored something like that. I think there's some value in that, for not only board members at meetings and whatnot, but Ellie is right, like, you can be threatened and you gotta deal with it, then file a complaint after the meeting, and you can set rules within those rules, but outside of that, people have First Amendment rights, and
Right.
that's just. Unfortunate.
Yeah, this June 3rd training is over in Holyoke, I'm going to that. I registered for it, so.
And then the last thing for trainings, which didn't make it into the agenda, but this is resource recovery training. And basically it is put on by Berkshire Community College. It's free. And in fact, if you have to leave your job to do it, some people are eligible for a stipend. But, it addresses the stigma and addiction recovery, it's harm reduction, helping understand substance use disorder. And, so this is a great thing actually for, service providers to go to, and we're hopefully we'll get a good turnout. But, EMS, doctor's offices, pharmacies, boards of health, planning departments, right? Like everyone could use a little bit of training and some base level understanding. So that is available. And so I encourage you to push that out to your network.
The only other thing about member updates, I've arranged a joint meeting with our police department and our Board of Health to look specifically at the issue of disaster preparedness and response. Which is an area that we share with whoever your incident commander is. In our case, it's the chief of police. So I encourage that notion, if you are in that relationship or with whomever it is, to be sure your board understands what its role is and your partner understands what your role is in the Board of Health. Okay, anything else?
We don't have a meeting for our subcommittee yet, then, right?
No.
We're just gonna hold off on
Until you
that.
get money. Right.
Yeah.
Our next meeting is May 12th, in person with remote option again. And this remote thing works really well.
Is it nice for you guys to be able to see?
Yeah,
Yes.
yeah, although I'm always looking up and, and although the camera's right in front of me.
us, yeah.
Right, yeah.
Actually, yeah, Jim is always looking right at me.
I know.
It's actually the camera.
A little unnerving. Good. Any other comments? You've all been terrific.
I think my only comment is I want to just thank everyone here, and those that aren't here for attending that CART meeting. It was 100% attendance. Speaking with Mike Hugo, he said that ours was like one of the highest attended meetings. And it just shows a commitment to the collaborative and whatnot. And, I'm really blessed that, 2 years later, throwing something together to see how we're all working well in our towns is just really happy.
Well, your leadership, Jane's leadership has made a huge
And
difference.
yours, Pat, I'm sorry, the anchor there that I know I can call you if I can't remember what it is I'm supposed to be doing, it's really helpful.
So,
Mostly
that
I
raises,
call Jane.
raises the question of when is the election? How long am I stuck here?
Yeah, I don't know anything about any election, does anybody else? No.
I think it's like articles of organization, if we don't have.
We do have to think about that though. We can rotate out at some point. You do so well, Pat.
Yeah, right, you, right.
All right.
The next agenda, I wanted to have a lighter agenda in case we wanted to talk about this work plan. Just because it's all written out doesn't mean that it doesn't need to change. It's
No,
just
right.
something
Yeah.
to start
No,
with.
you did a great overview, and at that 30,000 feet level, that's exactly, I think, what we needed. And once we get details, we'll dig in and prioritize and be sure we can do what we need to, or that we will tell them we can't do it because they didn't give us the money.
So we do have Tom Mency on, and Tom, you are muted. I don't know if you can unmute and,
Car.
Who is that?
he is from
Monterey.
the
Monterey.
town of Monterey.
Look for him, look for him.
He looks like he's driving.
You're not
Yeah.
driving.
Well,
right?
No, he's not driving.
All right. Tom,
Right.
thank you for attending.
Okay, I need a motion to adjourn.
I make a motion.
Second, moved and seconded to adjourn. Anybody dare counter that? Okay, all in favor?
Aye.
Aye, terrific. Thank
Thanks,
you.
everyone. Have a great weekend.
Yeah.